This edition of the Grenada Food and Nutrition Council's quarterly podcast has been graciously supported by St. Augustine Medical Services. St. Augustine Medical Services is committed to providing exceptional health care with state of the art facilities and a dedicated team of medical professionals. Whether you need routine checkups or urgent medical care, they have you covered. Their comprehensive services include outpatient services, full service laboratory, pharmacy and radiology, x rays, ultrasound, CT, and MRI, emergency room, 24/7 urgent care when you need it most, inpatient services, medical, surgical, and maternity care for all patients, ambulance services, rapid response for emergencies. Your health matters. Visit St. Augustine Medical Services today for trusted, compassionate, and quality care. Located at Library Junction, St. Paul's, Eastern Main Road. Contact St. Augustine Medical Services at 440-6173 or 6174 or 6175. Visit their website at samsgrenada.com. So with me today, I have Miss Elizabeth Japal. Miss Japal is the Drug Control Officer at the Drug Control Secretariat here at the Ministry of Education. Ms. Japal, thank you for joining us for the Grenada Food Nutrition Council's last podcast for 2025. Today we want to talk about the work that you do at the Secretariat and then just to share your advice and insights for parents, especially as we're in the holiday season and them balancing what will be happening to their children with the use of alcohol and drugs.
It's a wonderful opportunity to be able to share to the public as it relates to the season and the issue of alcohol.
So first, let's lean into the fact that we're recording this in December.
Yes.
December 2025. And with the Christmas season approaching, what cautions or concerns does the Drug Secretariat have regarding children's exposure to alcohol?
Right. So on the onset, right off the bat, I will say we definitely advocate for no alcohol consumption for minors. And minors, you could decide who's a minor, and that could go into another discussion. So we'll just say no alcohol consumption, no alcohol for young people. And we would like to look at young people from 0 to as much as 25. And if we can even get the age to higher, that would be great. Because studies have shown that the human brain is not fully developed until somewhere in the mid-20s. And of course, there might be outliers. There are people who it might mean 30. There might be the 21-year-old who acts as a 30-year-old. But for the most part, research has shown, scientific evidence has shown that the human brain is not fully developed until somewhere in mid-20s. And the use of alcohol can inhibit that brain development. So we advocate 0 alcohol, whether in the form of cookies or brownies or in cakes and drinks and local wines, whatever it is. We say no to alcohol for young people. And if we can ask people not to drink alcohol at all, we even advocate for that. But adults can do what they want. But until then, we are saying do not expose the young children to alcohol. Don't initiate alcohol into the system.
And at Christmas time, alcohol is placed in some of our traditional treats, whether that's cake and the sorrel. And there are also some commercially produced beverages that have 1 to 4%. What, specifically for those, not naming any brands, but sometimes a parent may see, 1, may not read the label, and 2, may see 1%, 2%, and think that's harmless. From the position of the Drug Secretariat, what warning do you have for parents with those commercially produced beverages that have that percentage?
So again, we say there's no safe limit to alcohol. You know, we have a tradition and it's culturally embedded that, you know, especially around festive season, whether it's carnival or in some cases Easter, Christmas in our local setting, that we let down our guard in some instances. Parents think, okay, well, you're 14 now, you're 15, you're 16, you're 18, whatever, you can have a little drink. But what sometimes people do not know is that one little, what they call a little drink, that where you're initiating that substance into the body of the child. For some people, that is what leads to what we call lifetime prevalence, meaning lifetime usage, lifetime consumption. If you didn't start at all, you had no idea what it is, you never tasted it, it never entered your system, it has no effect on you. Outside of your body, it has no effect. But once it gets into your system, you have no control over what happens next. For some people, they might decide, I don't like the taste, I'm not going to do it again. And for others, it leads to acquiring the taste, wanting it more and more, and then that leads to what we call dependence later on in life. And later on may not mean when you're old and gray. For some people, later on means an adolescent, a young person. We have seen it. We're not living in a vacuum. We see it around us. You walk the street and you see, or you go to some social activity and you see young people. You can see they're intoxicated, they're drifting, they're trying to climb a stairs, they could barely do it, they're staggering, they're falling down. You know they're intoxicated. And like I said, most time it begins with that very first drink, the initiation into it. So we are saying to parents, never mind the quantity, there's no safe limit, because you do not know that first drink can lead to what we call lifetime prevalence.
Mm-hmm. This edition of the Grenada Food and Nutrition Council's quarterly podcast has been graciously supported by St. Augustine Medical Services. St. Augustine Medical Services is committed to providing exceptional health care with state-of-the-art facilities and a dedicated team of medical professionals. Whether you need routine checkups or urgent medical care, they have you covered. Their comprehensive services include outpatient services, full service laboratory, pharmacy and radiology, x rays, ultrasound, CT, and MRI, emergency room, 24/7 urgent care when you need it most, inpatient services, medical, surgical, and maternity care for all patients, ambulance services, rapid response for emergencies. Your health matters. Visit St. Augustine Medical Services today for trusted, compassionate, and quality care. Located at Library Junction, St. Paul's, Eastern Main Road, contact St. Augustine Medical Services at 440-6173 or 6174 or 6175. Visit their website at samsgrenada.com. So, from the Drug Control Secretariat perspective, what trends or red flags are you currently observing among Grenadian youths where it comes to alcohol consumption?
The first issue is that of alcohol normalization. And I'll break that down a bit, where we think it's okay. My grandparents did it. I have an uncle who is doing it. I mean, my friends are doing it. So what's wrong if I do it? And I'm speaking from the perspective of a young person. So we have normalized the issue of drinking. A lot of parents think it's okay. I've seen parents, giving little toddlers the last drip or drop of, an alcoholic beverage, and the child might make a funny face and everybody laughs and thinks it's okay. At that point, we actually, again, like I say, initiating the alcohol into the psyche and the system of the child. So we have to be mindful that alcohol use leads later on to a lot of behaviors that we don't want, a lot of risky behavior. So you start off drinking like that, and the next thing you know, like for some teenagers, you get into risky sexual behaviors. You can then end up with more than one complication as it relates to diseases, what we might want to call dual diagnosis or comorbidity, meaning you end up with another problem. Alcohol consumption is linked to many health issues, the issue of diabetes and hypertension, especially in our local society. We look at the statistics, and I'm not going to go into no big set of data here, but our data is showing that we have many deaths related to diabetes and hypertension, and alcohol is a risk factor for those diseases as well.
Mm-hmm. Mm-hmm. Well, what is the position of the Drug Secretariat where it comes to providing support for youths who may now show through their behavior that there is some dependency happening? What are some of the programs and interventions that you have available?
Right. So first of all, we always do what we try primary prevention, which is the first phase when young people have not yet started. So we do that at a universal level, and then you could break down the levels. So where you come to a specific, you might deal with an individual on a specific issue. But we talk about universal prevention during the health and family life programs at schools, or in any other little setting. Teachers use the opportunity, whether through the General Assembly, or the coach he or she has a group of students, getting ready for an activity. He or she would speak to them about the dangers. So we talk about the universal prevention. When they have moved from, they started using, and you realize, like you said, that they need help, we then move into another level of prevention, secondary or later on tertiary prevention. And that might mean treatment. The issue is that one now has to accept and acknowledge that he or she needs treatment. And many times it's a challenge because people are always in denial. Oh, I drank today, but it's because of this issue, and they make excuses, not realizing that by just making excuses, you actually depicting either alcoholism, dependence, and so forth. So the first thing is acknowledgement. And when people do not acknowledge or accept that there is a problem, then it's very difficult to get the intervention that they need. And most times people are in denial. Oh, I can stop when I want. So then they hold up for a day or two, and they say, look, I didn't drink today. But by the next day, or they might hold up for the week, and by the weekend, they're exposed to some of the risk factors again, which might be their friends or colleagues drinking. They might get to a certain place where they used to drink or they drank before, and then it triggers dopamine and serotonin in the brain, and they again become excited and they want to drink again. And then they tell you, that was just for today. I'm a little stressed. I just needed a little drink. And it continues. So we have the facility like the Monge Health Facility, and I always want to say it like that. The Monge Health Facility offers quite a bit of help. There are 3 different institutions there. So people will say, there's Carlton House, and there's a walk-in clinic, day clinic, that runs from between 8 in the morning or 9 in the morning until 1 every day, every weekday, where if someone has a problem, they can call the nurse or the administrative staff and go in for some help. And if later on they need more advanced secondary assistance, tertiary assistance, they can be provided there. Private doctors can also do it. But like I said, we promote primary prevention, where we ask schools. You cannot expect one officer, the Drug Control Secretariat, alone to do it, or your unit alone to do it. So we have to, what we talk about is interagency collaboration and coordination, where each one helps one. I reach out to you, you reach out to me, and we together collaboratively we help each other.
Mm-hmm. There are some students who don't want to drink alone, and they may bring that onto the school compound. What is the position of the Drug Secretariat and your knowledge of what the schools are supposed to do to those particular students?
Right, so there is the school's policy on drugs, which states unequivocally that no form of drugs or alcohol should be brought on school compound. So any student who is found with drugs or alcohol on a school compound will stand consequences. We would want, for the most part, we will look at in-school suspension, because for some students, it's sometimes based on the background they're coming from. Their home is normalized with alcohol use, and they didn't know that they're committing an offense. Oh, we have this at home, I could bring some in school and share with my friends. But the school's policy states that you can be suspended for 2 to 10 days for such an offense. It's also placed in the Education Act. So a principal has his or her discretion to say, okay, you know what, I'm going to send you home for 2 days until you sort out, or I'm going to give you 10 days. And then what if that child repeats the behavior? He or she returns to school and then repeats the behavior. So you're actually losing out on valuable school time, and that in itself is a negative. You do not want to lose out on your valuable school time. You want to be in school when there is school. Yes. So as I was just preparing for this engagement, I looked at certain research, and there's this one from a UWI study which looked at students from 1980 to 1921, longitudinal study. And I took this quote from it that said, over the past 40 years, alcohol consumption, or what we now call heavy episodic drinking, and the burden of alcohol-related diseases among adolescents and youth in the English-speaking Caribbean has remained significantly high, with no recorded changes being observed. Now that's concerning. That for this long period of time, there seem to have been no change related to young people deciding and choosing to use alcohol. So that's a concern. This other quote that said young people now have more access, and that's one of the issues. They have more access and availability to an increasingly wide range of drugs and substances. And what are they doing? They're also combining them with alcohol. And when you combine drugs like that, you create what I earlier said, comorbidity, or you end up with what we call a dual diagnosis. You're moving from one health problem to a combination of health problems. So we are saying also that drug use among youth is a major concern. And again, in the English-speaking Caribbean and other parts of the world. But again, because of our association with plantation slavery and our normalization of alcohol consumption, in some society, young people and even adults don't use alcohol at all. But in our society, it's acceptable. But we have to start understanding that it's dangerous. It leads to death and disability. It leads to impulsive behavior. So we're saying to young people, choose not to use alcohol. You don't want to get in trouble with the law, and you don't want to get in trouble with your school authority, and you want to lead and live a healthy, normal life that exclude alcohol consumption.
What final words of encouragement do you have for the population as it relates to alcohol and drug use?
I would like to say to young people, and I take this quote from a friend of mine who also is into prevention. I love it. He says, break free. You have to decide to break free. You have to decide to make decisions that are healthy to you and to your life. You have to choose to be different. And this part, I'm saying this now, here's a break free. Choose health, choose life. Because there's no positive gain. There's nothing to gain more than a momentary euphoric feeling when you use alcohol or any other drugs. And considering that alcohol use is also linked to other substance use. Because many times young people begin their substance use with alcohol, and later on they gravitate or move into other drugs, other illicit or illegal substances, controlled substances, which can then lead them down a path of getting in trouble with the law, leading to violent behaviors, leading to issues related to gambling and all of that. All of that is like a cycle. It's all intertwined. It's like the tentacles of alcohol will reach out and pull them in to do other things. So we're saying break free from that cycle. Not because you're in a society where alcohol use is normalized or the media has normalized alcohol use. So there is this beautiful girl in a swimsuit or whatever else she's wearing, a long gown, but she looks so nice, but she's having an alcoholic drink. And there's this, like my son was a buff guy, this guy is strong and he has muscle and he looks really good. And the women and the girls are looking at him, but he also has an alcoholic beverage. And media normalization is another risk factor. Again, we also want to talk about protective factor, where parents themselves must be the first example and role model to their children. So if your child grows up in a home where you're always drinking, and you say to them, this is not for you, you might be able to say that for a while, but in your absence, they might take a drink, and later on they might say, my mom and dad used to drink a whole lot, so it seems okay. We have to know that our actions and behavior, whether knowingly or vicariously, affect the young people who are watching us. So again, as a protective factor, we're asking parents to talk to your children. Do not just wait for the school to tell them about it. Do not wait for their friends, because most times their friends are already using. Just to add in a little recent research, we engaged with the University of Michigan and Pennsylvania, who are in Grenada. And we carried out some research with schools, students, school administrators, students, on the street, just asking them about alcohol use and other drugs. And in one instance, when they were asked, how many of your friends you think drink? And they were like, how many? About 95%. So students themselves are saying the majority of their friends and sometimes themselves, they drink. So we have to move away from this norm of it is okay. Alcohol is a poison to the human body, and it, like I said, inhibits brain development. It leads to other compulsive behaviors, violent behaviors. It's like a stepping stone to using other drugs. And in another session, we'll talk about the emergence of and proliferation of drugs like what we call NPSs, new psychoactive substances, which is wreaking havoc and causing, thousands and thousands of deaths in other parts of the world. And we know once it's out there, it's actually creeping into our society as well. So we say no to drugs. It's a quote we've heard for years, but there's no better way to say it. Say no. Choose not to use. And if you are doing it, break free. You may not be able to do it on your own. You might need help. There's help. Speak to the drug control officer. Speak to a responsible adult. Speak to your teacher. We will then direct you to the help that you need. But again, choose health. Choose life, young people.
The Grenada Food and Nutrition Council would like to thank Mrs. Elizabeth Japal, who serves as the Drug Control Officer for the Drug Control Secretariat within the Ministry of Education, for joining us on this edition of the GFNC podcast. If you would like more information about the Carlton House Day Clinic, please contact 473-440-0090 or the Rathdune unit at 473-440-3154. The Grenada Food and Nutrition Council would also like to thank St. Augustine Medical Services for their in-kind support of the podcast.